So good afternoon, everybody, and welcome to the business reopening workshop for retail and vehicle dealerships. My name is Lynn Ladd. I am the Director of Membership and Programs at the Ottawa Board of Trade. The mission at the Ottawa Board of Trade is to create prosperity through our work in advocacy, collaborating with external stakeholders like Ottawa Public Health and leadership. We represent all businesses in Ottawa at every level of government, and we deliver benefits and programs that will support a thriving business community. Never before has this been more important. Please feel free to visit our website for more information on our policies and our member benefits, as well as our new Ottawa reopening strategy that has a number of free programs that will support you, including our Business Insights virtual event series, the Business Peer Groups, which is launching next week, which is peer-to-peer mentoring, and also for the Post Promise that will help you inspire confidence for your customers and for your employees. We're very pleased to offer this workshop series along with our community partners, the City of Ottawa, Ottawa Public Health, and the Ottawa Coalition of Business Improvement Areas. I just want to point out that we have a number of folks representing their BIAs on behalf of all of their stakeholders. So thank you so much for that. And a thank you to Cindy Van Buskirk and Brian Simpson at the City of Ottawa, Phil Jansen at Ottawa Public Health, and Mark Koleski at Ecobia for your continued collaboration and dedication to our community. We'll begin with a short presentation, and then it'll be followed up by a question and answer. Fortunately, we have a small group today, so I think we'll have a very engaging discussion afterwards. And today's discussion is going to be presented by Dr. Brent Moloughney, the Associate Medical of Health for Ottawa Public Health. So Brent, I am happy to turn it over to you now.
Great. Thank you very much, Lynn, and welcome folks to this afternoon's workshop. As Lynn said, it's one in a series. I have only a small number of slides to show you because there's so much information that's available on our website and others. What I'm really wanting to get to is, frankly, the questions that you have, and I'll do my best to answer. If there's items that I'm unsure about, then I will certainly signal that, and we'll take that away and get an answer for you and get it back and distribute it through Lynn. So yeah, so I'm at Ottawa Public Health, and what I want to cover briefly this afternoon, and you're going to notice me looking to the side because for some reason my slides aren't right in front of me on my other computer, is a quick overview of the current status of COVID in Ottawa, discuss some safe infection prevention and control practices and control measures for safer reopening, and some common challenges. I mean, first, I want to take a step back and acknowledge that, you know, employment and income are important contributors to people's health. And I think for that reason, I mean, Ottawa Public Health is you know, been actively supporting the business community through various mechanisms to support reopening in a way to be as safe as possible, because that's the balancing act, of course, that we all have. And I mean, it might come up in conversation, but you know, looking ahead and looking what's happening in other parts of the world, you know, one of the things always is the concern for resurgence of the virus. Now, the good news is at the moment, the current situation in Ottawa continues to improve with a relatively small number of cases on most days. Hospitalizations have essentially decreased to zero, or sometimes there's the odd one here or there, which is really good news at the moment. And fortuitously, the number of deaths have also diminished considerably. The challenge, though, because I mean, of course, the risk when I say these things, people will say, "Oh, it's all okay, and we can go back to normal." I'm hearing some stuff in the background. Just make sure you mute your lines, please. Thanks. That we're trying to open, to be able to try and get back to as normal as possible, which of course intrinsically involves the potential for interacting with a whole lot more people than we were. At the same time where the virus is still present in our community, like there are still cases, there's still transmission occurring. And most of us are still susceptible. Probably 95% plus of us are still susceptible and not been infected. So we've got this concern of mixing transmission plus susceptibility and increasing opportunities for interaction. So this is where the caution comes in trying to do this as safe as possible. Now, it was more earlier on in the reopening process than lately, but we were frequently being asked, so when is such and such going to be open, and what's it going to look like, and what are the rules going to be? And certainly appreciate those sorts of questions. The reality is that this is a provincial emergency, and the province has the policy lead. So they're making the decisions as to what opens, when. They often will identify some restrictions. And the reality is that, I mean, at local public health level where I am, we don't typically get advance notice of exactly those details. So it's difficult to anticipate all of the scenarios that are involved. And I've already stressed the importance of opening with caution, so I won't belabor that. Some of the things that I'll want to just cover briefly, as I said this afternoon, is around the typical things that you have to go through when you open in terms of your space, your employee and customers, supporting vulnerable customers and staff, and the communication aspects. And of course, looking at the available guidance. Typically, the province has been putting in health and safety guidance, which is important from a perspective of an employer and protecting your staff and your responsibilities in that way. But of course, with customers and clients involved, it's a little bit a bigger issue than that. And I'll talk about some of the principles and then some resources at the end of this presentation. So in terms of general practices, and really recognizing that you know your business best and your operations and what you need to do and the options that you have, but some of the things involve, depending on the type of business, trying to reduce, frankly, the number of staff that are in place at any one time. And so to the extent that you can have people working from home or working staggered shifts, that's a good thing, because then there's less opportunities for crowding, less opportunities for interactions, and easier to maintain distancing. And physical distancing is still and will be our primary mechanism to try and prevent transmission. Certainly, it's important for staff to be screened daily to ensure that they're fit for work, that they don't have symptoms. If they have symptoms, they should not be at work. If they develop symptoms, they should go home immediately, and in both cases be tested. The importance of washing hands, particularly after touching high-touch surfaces, and certainly before you touch your mask or you drink or you have something to eat. Those are very, very important. And really designing your space to say, well, how will we maintain physical distancing? How do we want the flow of people to occur? Are there interaction points where, someone, say, sitting at a desk or standing there, people will be coming up to them on a regular basis, and therefore you want a physical barrier in place like plexiglass, which we see in a number of settings. And of course, signage. I mean, there should be signage as people come in to remind customers that they should not be there if they have symptoms, as well as to remind staff of this as well. As I'll mention later, the importance of cleaning and disinfecting regularly, and certainly the high-touch surfaces even more so. And whatever equipment is required for staff, for example, the importance of having cloth masks. And we're going to talk about, oh, here it is. Yes, so as of midnight today, that's passed, as you know, there is a directive in Ottawa and surrounding areas that for mandatory masks in indoor public spaces. And the directives, which are all similar amongst the 4 public health units, is that all businesses to have a policy in place, to post signage, to have hand sanitizer in place, to have staff masking, and to be asking customers to remind them that they should be wearing a mask. And certainly there's more information available on our website, and I suspect you may have some questions about this, which we'll come back to. Other issues that you'll need to be thinking through, they're listed here, and we do have a checklist on our website that can be helpful for you. And I'm just going to walk through these and make some comments. So around staff scheduling, we recommend that, if it's possible, to have staff in teams or cohorts, so that they are the ones that work together and there's another group that work together. The idea being that if one of the staff people end up becoming ill with COVID, that it limits the amount of staff that you have that are exposed. So it's one team of your workforce versus a major part of your workforce. You want to avoid people congregating, so that means staggering start times, end times, lunches, and breaks. Typically, lunch and break rooms have limited space, and so those need to be marked as to how many people can participate there, and then the break time scheduled in a way to accommodate that. We had problems in workplaces early on where during break time, people sort of let their guard down, and because they were staff, they were worried less about them, and didn't maintain physical distancing, and transmission occurred. It takes longer to do some things, including extra time for cleaning and disinfection, so you need to build that in. And you need to maintain awareness and avoid the sort of COVID fatigue in terms of efforts to keep up your efforts. The one thing I'd say about COVID is that it's a stealthy kind of virus, and it basically takes advantage if you provide it opportunities for transmission. It finds a way to make its way between people. I've already talked about active screening. We have a screening questionnaire on our website. Staff should be indicating every day that they don't have symptoms, no recent international travel history, and they haven't been into contact with anybody. And as well, there should be signage posted for customers to the same issues. Physical distancing, depending on your setting, this can involve looking at the size and configuration of your space, and how many clients or customers can you accommodate and maintain distancing, how you're going to have lineups, how you're going to have flow to maintain that 6-foot difference between staff. And listen, just because we're doing mandatory masks now, that doesn't negate the importance of distancing. Distancing comes first, and masks is an additional thing that we're doing, trying to reduce the risk of transmission and to be able to support reopening. Certainly, and many stores already do this, is having markings and lineups as reminders to people as to what the 2 meter distances are. Sometimes there needs to be a fair bit of guidance as to here are the lineups for the caches, for example, to know where to go. Shopping etiquette. We've got respiratory etiquette, where we're supposed to cough and sneeze into our sleeves, and then wash our hands. Where shopping etiquette is don't handle a lot of things. Just try and handle the items that you intend to purchase. And then overall, looking at your operations and identifying where are all the places that people can come in contact with each other and touch things, and therefore put steps in place, to prevent people from coming into contact with each other, and that might be signage so that there's unidirectional flow, and then for the high touch areas is additional cleaning. Staff should know what happens or what they should do if they become ill. Again, employees who are ill should not come to work. I know this goes against our sort of our culture in terms of in the past, it's just a cold, I'll go to work. That in the world of COVID, that's not a good idea. That's highly not recommended. They should not be at work. And in fact, they should go for testing so that we can rule out COVID. If they develop symptoms at work, they should notify their supervisor immediately and go home and seek assessment. More information on symptoms and testing is available on our website. Certainly, while the individual is waiting for test results, they should be self-isolating. You have to be treated as though they are infected until proven otherwise. There may be some other situations where Ottawa Public Health gives advice to individuals with symptoms or other issues to self-isolate, and strongly recommend that you support that guidance, because there's a reason why we're asking them to do so. Let me just back up for a second. If you do have someone, a staff person who does turn out to be infected with COVID, then here at Ottawa Public Health, we will work with you to work through who was exposed, what the communication and instructions need to be for staff and customers. So it's important to have access to hand washing and hand sanitizer. It's now part of the directive at all entrances and exits to your facility. And the rationale for that is that one needs hand sanitizer. You're supposed to wash your hands or clean your hands before you put your mask on, as well as when you take it off. And certainly now all staff are to be wearing masks if they work in an indoor public space. And there's instructions on our website as to how to safely put on and off masks. And it also, I mean, if you're in a situation where people need a higher level of protection, actual personal protective equipment, then as an employer, you have responsibilities to make sure that they have access to that and know how to properly use it. Cleaning and disinfection, I mean, it should be daily for surfaces, and for those that are high-touch surfaces, like listed there, like the door handles and lunchroom counters and meeting rooms, should be at least a couple times a day. In terms of what products, I mean, it's not actually that difficult to inactivate this virus when it's on surfaces. And so, every household products that you'll come across, things, not that I'm suggesting a particular brand name, but things like Mr. Clean and Lysol, those kinds of things, you'll notice that they have a DIN number on them, which means they've been approved by Health Canada. So that's what you want to look for any cleaning product, that it has a DIN number. It tends to be small, tends to be near the bottom of the label, and then follow the manufacturer's instructions as to how to use it. In terms of resources, they're listed here, and you'll have access to this slide deck with these hyperlinks from Government of Ontario, City of Ottawa as well. We worked with the Board of Trade and Businesses to develop a business toolkit, and that's on the website for Ottawa. And then at Ottawa Public Health itself, we have a number of resources, including the employee screening questionnaire and a service provider reopening plan template and checklist. So that's very quickly what I was going to share with you. And as I said at the beginning, I'm most interested actually in hearing what kind of questions you have and doing my best to answer them.
All right, so we can handle the questions in a couple of different ways. If you're feeling a little shy about being on camera or having your voice heard, you can absolutely post your questions in the chat. If not, just feel free to turn on your camera and raise your hand. We will acknowledge you. While we're waiting, I would dearly love to ask a question on behalf of Ottawa Board of Trade. So my colleague Leanne, who regularly has been going into the office, I guess what a lot of people are wondering is what actually constitutes being in a public building. So for example, is our office considered public, even though we don't get people wandering in like you would in a shopping mall or at something that had a street front? And so she wants to know, when she's there alone in the office, does she need to be wearing a mask?
Right. So essentially the directive applies for indoor public spaces that members of the public have ready access to. So in terms of it, so there's a list in the directive. So it would be places certainly like retail locations for sure, shopping malls, places of worship, that sort of thing. The common areas. So for example, of a hotel or motel, the lobby that anyone can come into, that would be considered to be in scope. Even the common areas of a hospital. Typically there's a food court. Typically there's a major corridor. There's usually a volunteer store. I mean, when those open, that would also apply. So the places where members of the public can easily and routinely access, those would be included. Now, if you're in typically an office setting would not be included, except for the part that has ready access to the public. If you're in what sounds like a low volume office where no one is really coming to visit you, it seems not necessary to be wearing a mask all day if you don't actually interact with people. But if you were in, say, a receptionist and people were coming in and out in the reception, then it would apply and you would be wanting to wear a mask. In fact, if you were doing a lot of, for example, counter service to the public, you probably actually want to have a plexiglass barrier because of the extent of contact. For your example, where hardly anyone ever visits, but say someone does come in and they can just walk into the office, then that would suggest you should have a mask available so that you could put it on and have them maintain their distance before they fully come in.
Great, thank you. Thank you very much. She'll be happy to know that she knows exactly what rules to follow now. So Tanis from Heart of Orleans, the BIA in Orleans, has posted a question about the Schenkman Theatre. Tanis, did you want to unmute and speak direct about your concerns?
Hi. I don't think I have any concerns. I was just kind of relaying what we were told with respect to public areas. Like a lot of the Schenkman is public, like the lobbies, the theater, the bathrooms, and we've been told that we wear a mask in those areas. And our office, we're okay not to wear a mask.
Yeah, no, you know what? That's a really good example. So there is a listing of sort of cultural kinds of places, theaters, cinemas, concert venues, and admittedly, not all of these are open because some of them won't be allowed to be open under the province's reopening plan till stage 3. But you're quite right. What you've identified is there's some public spaces like the lobby, like the actual theater sitting area, the bathrooms. Those are public access and therefore would be subject to this directive and should be wearing a mask there. Whereas the back office functions that are not accessed by the public would not be. Now, of course, just because they're not part of the directive, I mean, if there's a fair bit of interaction and people, and you may not be able to maintain distancing back there, you probably want to wear a mask there too.
True enough. There's 2 of us in my little office, so we're okay for now.
Okay.
And we're actually not allowed in the building yet, so we're really okay. My dining room is safe.
Yeah, you're right. Yeah, no, as I said, I mean, I expected that you're stage 3, but based on what the premier is saying, I don't think stage 3 is necessarily that far away. So it's good to begin thinking about, okay, so what will this look like when we do get ready to reopen?
For sure. Thank you.
So we have a number of automobile-related businesses on the call today, and I'm wondering if we could spend a couple of minutes maybe talking about issues that are specific to them, starting with great strategies for safer reopenings, and I'm wondering about things like scheduling their visitors rather than walk-in traffic.
Yeah, and I guess it depends on the size of the dealership and the volume of visitors, because of course this varies considerably. Some dealerships are quite large, and others are not that much bigger than my office. So it really varies, and so it also depends on how much foot traffic. Again, similar to a retail location, you probably want to give some thought to, so what is the sort of the reasonable maximum number of people we can have in here in order to maintain distancing? And again, that's going to vary on your space. Certainly, Lynn, as you indicated, having people by appointment is one really good way to space people out, and so they're not waiting around. You may need, typically dealerships have a receptionist, and so they may need to take a role in scheduling people and saying, listen, we're overflowing here, and let me give you a time and we'll make an appointment for you to come back when it's less crowded, because we want to keep everyone as safe as possible and space people out. So it really, I think that's a good strategy, but it depends on how much space there is and what kind of volumes that you have. But you should have an idea as to how many we can accommodate. Some smaller dealerships, it might be very few people that can actually be accommodated inside and maintain distancing.
I'm also a little curious about the best way to manage a test drive. Because,
right.
They really don't want to just send them out with their brand new cars alone, but that is a small and confined space, and the steering wheel and some of the controls are going to be very high touch points.
Right. No, that's a great question. And the one thing I would say is that people are a bigger risk to you than surfaces. So always keep that in mind, not only in the workplace, but in all aspects of life as we try and navigate things with COVID, is that it's other people And of course, we know that people don't need to have symptoms to be infectious to us. So that's why it's really important to have distancing as our primary strategy, and then masks on top of that. So yeah, the test drive piece, that's a challenge. Because it's virtually impossible in most vehicles to maintain 6-foot distancing between, you know, the test driver and the salesperson. The other concern here is that it's not just a one-off. It's not just, oh, I'm just going to do this once and I'll never have to do it again. It's actually part of the job. And so if you made it routinely that you say sat in the back seat, we're talking about repeated exposure, potentially multiple times a day, in that kind of environment. And as I said before, masks don't replace distancing. And so that would be a concern, to expose yourself to that kind of a situation. So some of the things I've heard people do is actually, they sort of participate, but in a separate vehicle. So they don't just say, here's the keys and off you go, but rather have the dealer rep, the sales rep, has their own vehicle, and they actually follow the other car. And a lot of dealerships have a defined route as to what, you know, they want people to take. That's a reasonable distance, but also shows, you know, different features and different road conditions for the vehicle. But I would strongly urge, like, co-riding with people. I understand that's the normal operations. I understand why you'd want to do that. But from a COVID perspective, it would be unwise, just because it's impossible to maintain distancing. Masking doesn't replace distancing, and the problem of repeated exposures.
Chandra, did you want to share how you're managing that at your place of business?
Sure, can you hear me?
Yep, we sure can. How are you today?
Good, how are you?
Excellent.
So we have 3 dealerships, and we're just sending the customer on their own for the test drive. We have someone that's in charge of sanitizing every vehicle, and we're keeping the log of our visitors and the log of the people who go on the test drives. And then the vehicle, we have signs where it's not needs to be sanitized, has been sanitized. So then we make sure it's has the green side up before they go. And then we give them sort of a route, of course, a copy of their driver's license. So we have something, we usually a picture now rather than touching their driver's license. And then make sure that we get someone to sanitize it when they come by.
Yeah, no, that's a really good idea, and thanks for reinforcing that yes, you would want to sanitize the high touch surfaces, the steering wheel, the shifter, the turning signals, all the things that people would potentially be touching, probably the dashboard as well. You'd also, just to as an additional sort of protection, you'd want them to use hand sanitizer on their hands before they even got in your vehicle. So therefore, that's reducing the risk of contaminating inside the vehicle. And then just in case they pick something up from the vehicle, that they'd use hand sanitizer after leaving the vehicle. So those would be 2 additional little steps that I would add.
So it would be probably somewhat easier to manage the physical distancing with respect to their service area, because typically people come in for appointments and at specific times, but I guess the trick there is going to be those high touch areas once they take over sort of control of the car.
Yeah, so it kind of depends on how they do it. I mean, a lot of places now have drive-in bays where you drive it in, and then basically you're handing off the vehicle, and someone else is grabbing that vehicle. So certainly there needs to be distancing as the driver gets out and the service person comes, and the check-in process there. And then you need that step of the keys. You leave the keys in so you don't have to touch them, I guess. But you know, you could certainly sort of sanitize the steering wheel and the shifter and the devices that you're going to be touching while the service person is driving the vehicle. And then I would be cleaning it again, like sanitizing those surfaces before returning the vehicle to the owner. Again, you're going to have to, at the check, usually there's a check-in desk in the service area where you're going to have to maintain distancing there. Depending on your volumes, it may be warranted to even have plexiglass there. Otherwise, you're going to have customers standing back 2 meters from the desk and the service rep, who's usually there behind a computer terminal. And then usually there's multiple customers, so then you got to manage your line. Similarly, typically there's a little waiting room area, I think it's a decision whether you even maintain that, because it's just going to create all kinds of challenges for you in terms of distancing in that space. Because if you keep it, then you're going to have to really mark it out in terms of where people can sit and to make sure they're 2 meters away from each other.
Interesting. It's certainly a great puzzle solving time to if you're into that kind of thing. We have a couple of other folks on the call that I'm not 100% sure we would have necessarily addressed some of their pressing issues. I'm looking for one of our guests. Is David still on the call? David runs a Taekwondo school, and I'm just wondering if there's anything specific that we can help address for you today, David. If you want to post it in the chat, because you're okay so far? Okay, David's just answering me in the chat, which is nice. Excellent. Do you have any precautions for David in particular? It being a Taekwondo school, now there's more contact with the feet than there are with the hands, and I'm guessing that's part of the stage 3 reopening.
Yeah, so I'll put Taekwondo in with other martial arts and sort of deal with them collectively. It's certainly, we'll see more in stage 3 about their opening, because at the same time, fitness centers and gyms would also be opening in stage 3. There is a little bit of fuzziness with the provincial guidance in terms of the opening of martial arts facilities in the interim and as part of stage 2. What a number of health units are indicating is that, typically there is a provincial association that has provided guidance. I know, for example, Karate Ontario has provided guidance to their member clubs. I think Taekwondo may have done as well, where they'll have provided guidance, and local clubs have memberships in those provincial associations, and therefore, as far as we understand, are eligible. Just to tell you, in public health, we don't adjudicate the provincial opening rules. We sometimes are called upon to try to understand them. And that's why I'm saying this one's a little fuzzy. But in terms of public health guidance, if you're opening and you feel that you're eligible to open, that you need to modify. Because as you indicate, there can't be sparring because you got to maintain distancing between people. I know that a lot of martial arts, that there's often in karate, they call it a kiai or a shout as you strike or pretend to strike something. In the world of COVID, that's not a good thing, because you're going to have more respiratory droplets coming out at that point. You're going to want to maintain distancing. So if people are doing katas or basics, you got to set up your line so that people are spread out. Typically, especially if it's a place that is a little bit more confined, crowded confined spaces are challenging for COVID in terms of increasing risk of transmission. So especially if the exertion level isn't very high, then considering wearing masks to reduce spreading of respiratory droplets would be a good idea. And of course, in stage 2, locker rooms, other than access to washrooms, are closed at this point.
David has also asked if OPH has a position on the recent news that COVID-19 might be airborne in addition to droplet transmissions.
Yeah, so it's I've been reading some of the media stuff, and it's a little bit confusing, frankly, to me as to how people are using the term airborne, because to me, respiratory droplets are airborne. So if I'm speaking to you and you're relatively close, my droplets are going through the air and potentially going in your mouth or nose or eyes, and that's how it's transmitted. So we sometimes in medical circles talk about aerosols, which are really fine droplets that are produced by certain procedures, medical procedures. So for example, intubating someone who can't breathe will generate these really fine particles that get through normal masks. What I think people are talking about the airborne beyond just the respiratory droplets as we talk, and certainly if we cough or we sing or we shout, those droplets are going to go farther, is that in confined indoor spaces, so in that sort of confined meeting room, or in that cozy restaurant that used to be kind of quaint and romantic, now it's potentially a very confined space. The concern is that by spending time in that space that you have a risk of increased risk of exposure. So, I mean, I think it's just another variant of respiratory droplets. But in terms of confined spaces, it's an increased risk that there could be transmission. There's also been cases where if there's been like an air conditioner sitting behind someone, that it's facilitated and the thinking of transmission. So it's the thinking that those droplets that are normally being expelled are riding this current that's going directly towards someone else's face and giving an increased opportunity for transmission. So in a dojo setting, some which the ones I've been in can be sort of smaller. I think one would want to be spreading people out further and considering greater mask use and being cautious about really increasing people's physical activity level in a confined space.
Great, that's a great answer. Brent, can I ask you to, now that we're well into the question session, can you stop sharing your screen, and that way if somebody's raising their hand, I'll be able to see them better?
Oh, sure.
That'd be great. Thank you so much.
That's easy.
So,
there you are.
Thank you. And then I've had a chat question come in that confined space concept, would an HEPA filter air purifier help? I don't know what a HEPA filter is.
Yeah, so HEPA refers to high efficiency particulate. I mean, it's not going to harm. I mean, certainly you want your ventilation system to be at its optimal. I don't think we know in terms of exactly how to manage these confined spaces. I think though we're at a point where we would view them as higher risk, where there's low ceilings, people are close together for a prolonged period of time, because really the 2 meter rule is really about sort of fairly brief interactions with people. But once you're talking about 30 minutes, an hour, 3 hours together in a confined space, even if you're 2 meters apart, I think we'd still be concerned about an increased risk of transmission there. Okay,
thank you. I see that Lee Lacombe is on our call today. Lee, I don't know if you're feeling brave enough to turn your camera on, but Lee specializes, he's a commercial real estate agent, and he specializes in working with retailers, obviously why he's here today. Hey Lee, how are you doing? Nice.
I'm doing well. I was driving, so I was kind of just keeping quiet.
Oh, that's okay. I was just wondering if, because I'm sure you're here on behalf of a number of clients that you're working for these days. I know you specialize in retail space. Did you have any specific questions that have come up while you're dealing with your clients?
No, not specific. I have had some people ask about the, we're seeing it a ton on the news and on the internet, people trying to enforce masks going into their facilities and people getting upset about it. And no retailer wants to deal with this situation. So the enforceability of all of this, and because the stipulation also says if someone's got a medical concern that they can't wear masks, and I don't know the validity of all of it. I'm not a doctor. I don't know any of this stuff. So some of my clients have asked me, like, if we're opening, like we still have the right to refuse service if we're not comfortable serving people without masks. So I just wanted to maybe check in, see we're still on page. People can still refuse service, and I don't want any of my clients getting in trouble. More headaches than necessary, kind of thing.
That's
Yeah,
a great question.
yeah, no, it's an interesting sort of balancing that we're trying to do here, where our objective is to increase the proportion of the population that are wearing masks in these retail settings. Let's just take retail for a moment. Certainly when we survey, people tell us a certain level of how often they typically would wear a mask. Anecdotally, when I go through stores, it's probably a little bit less, but it varies from store to store. And we're trying to in order to prevent a resurgence, to say what else can we do to give us the best chance of being able to reopen is for a greater proportion to wear masks. One of the things that when I was speaking with the Retail Council of Canada was they were saying, we really, as operators, we don't want to be put in a position where we're policing this or enforcing this and needing to deny entry and having that confrontational situation as people come in. And so we certainly heard that. And when we put these directives together with our 3 adjoining public health units, we talked about that, and they said, yeah, I think that makes sense. And so the way we crafted the directive was that the operator would have a policy, and that as part of that policy, they would be having signage, they would be having hand sanitizer available to people, that they would be having their staff masked unless they're in a back area that's not public access or behind a barrier, and that they would be reminding customers if they weren't wearing a mask of the contents of the bylaw. But we were avoiding that situation where they were requiring, and in a confrontational kind of way. It's more of in a polite way saying, oh, by the way, do you know there's a bylaw? Now, there are, as you say, a number of exemptions. So, for example, young children, people with a medical condition, there's some other exemptions as well, which an individual customer could easily say that, oh, I have a medical condition and that's why I'm not wearing a mask.
That makes a lot of sense. And it's sad to me that some of our retail workers and restaurant workers are going to, in effect, be policing things moving forward, because they're often young and maybe it's their first job. But
I think that's the intent, is that they're not policing this.
No, but I guarantee you it'll be a while before that message spreads appropriately.
Yeah, no, I think there'll be a transition. I think we're in an educational situation here. Like a lot of people are already wearing masks. We're trying to nudge it up. And I think, I think it'll take a little bit of time for the public to fully understand, and that for operators and their staff to fully understand. And so we're spending a lot of our time explaining and educating.
Yes, indeed. So we still have a few more minutes left. And we have a couple of our BIAs represented here. And of course, the BIAs are attending on behalf of a number of different businesses within their area. So Judy and Andrea, I didn't know if you wanted to take this opportunity to ask anything specific on behalf of, your sort of membership, or if you had questions that are a little outside of today's topic but need to be answered. I'm just going to invite you to turn your mics on and ask away.
Hi, thanks, Lynn. I don't have any specific questions at this point. We have a weekly open call with members every Wednesday morning, so I expect to receive a lot of feedback from today's activity. Then I'll be in a position to maybe provide some constructive feedback on the mask rule. One thing that was brought up, has been brought up by a couple of different business owners today, was they're just concerned with training their staff, especially in the retail sector, having a lot of part-time and young, say, teenage staff, on how to deal with customers that refuse to wear masks and that sort of thing. My initial response to them was that, well, really there should always be someone that's a manager on site, and that one individual should be trained, and that one individual should be the one asking people without masks to put a mask on or dealing with that issue, and that not every staff member should even be really approaching customers that don't wear masks. That was, again, just my initial sort of reaction to the question, but so that would be something, I guess, that would be of interest for at this early stage.
Thank you, Andrea. Judy, do you have anything that you want to add to the conversation or ask?
I guess just my question is, what does the policy that businesses need to develop need to look like? Like, what does it need to cover? Because I was reading that every business has to adopt a policy to ensure that no member of the public enters the business without wearing a mask. And so what is OPH looking for? Because a lot of our businesses are small, independent businesses. They don't have, you know, a lot of HR experience or expertise to lean on to write a formal policy. You know, as they've been going along, they've been developing things and getting sort of templates from other places. But writing these formal policies can be a challenge for the small independent businesses. So what is OPH expecting that to look like to ensure the businesses are all compliant?
Yeah, no, that's a great question. And if it's not already there, we should have a bit of a template or checklist on our website, on OPH website, in the mask area to provide guidance in that area. Toronto was a little bit ahead of us in my conversations with them about this, and they had put up a template. So my understanding is our staff were kind of borrowing from them and using that, and it's really around that you know they've training of staff, that they have signage, that they have hand sanitizer, that the staff are wearing masks, and that you know that they see a customer without a mask, that they're providing a gentle, polite reminder to them about wearing a mask.
And Brent, or maybe Phil, who I see is on the line here, maybe one of you can answer this question. I haven't read it yet, but Phil shared with me the instruction to businesses on mask usage. Does it have some guidance, that document? Does it have the guidance on what the policy should look like?
So I mean, the letter or guidance to employers refers to the desire for a policy or the requirement for a policy. But as I said, it'll be outside of that will be the guidance on the actual policy. And as I said, my understanding of staff are working on a template that would be on our website soon.
Okay. Phil, I noticed that you unmuted yourself. Do you have anything that you can add?
Just to provide an update for Brent and folks, so that yeah, staff are working on it and it should be up, I'm hoping this afternoon. It's just a matter of getting it in the right content for folks. And like Brent said, yeah, the letter of instruction is really where all the information for masks and what Dr. Etches has required, it's all in one spot in the letter. So it's important that folks read that carefully, and that that in some way can help you shape a policy, because it really tells you what you need to do to implement. Thanks.
Thanks, Phil. So that letter of instruction that Phil is referring to, we will be distributing that to everyone who registered for today by email, probably later this afternoon or early this evening, so that you'll have it in a timely manner. And do we have any other questions that people are just dying to ask about COVID and reopening their business? Okay, so I think we have covered off everybody's questions for today. So I'm just going to remind everybody that we did record today's session. Within a couple of hours, I'll have it live on our website. And once that happens, I'll send you the link so that you can watch it or share it. And I will also attach the documents that we were just referring to, including this instruction to business owners. So on that note, have a great afternoon, everybody, and have a safer reopening of your business, and have a wonderful day. Thank you so much.
Great. Thank you.
Bye-bye.
Bye.